Hi everyone, I am Beatrice. In today's video, we will look at antihyperlipidemic medications. So these are medications used to treat hyperlipidemia. Hyperlipidemia has to do with high lipids or high fat in the blood. So when we look at high cholesterol, high triglyceride in the blood, we're looking at hyperlipidemia. So this medication addresses it, it treats it. Now, before the end of this video, we'll look at some NCLEX-style questions that will test your knowledge on these medications. So if you are ready, let's begin. In this video, we'll look at 5 classes of anti-hyperlipidemic medications. Although there are other classes too, especially biologics that also treat hyperlipidemia. So the first one on the list will be HMG CoA reductase inhibitors. So these are the statins group of medication. So when you hear of atorvastatin, simvastatin, any of those statin group of medications, they are called HMG CoA reductase inhibitors. So their mode of action, just from the name HMG CoA reductase inhibitors, they inhibit HMG CoA reductase. So this HMG CoA reductase, they are enzymes that synthesizes cholesterol in the liver. So when they inhibit it, they end up inhibiting cholesterol synthesis. So in other words, they help to reduce production of cholesterol in the liver. Also, it's going to decrease the level of LDLs. LDLs stand for low density lipoproteins, and that's what we call the bad cholesterol. While HDL, high density lipoprotein, is the good cholesterol. Now, indication from the mode of action, we know that it's indicated for anyone that have high cholesterol, high low density lipoproteins, which is that bad cholesterol. It's also indicated for prevention of coronary artery disease, stroke, anybody at risk of any heart disease. They give this medication to prevent it. Now, the side effects you need to know about this class of medication include myopathy, that's muscle aches. Then we have rhabdomyolysis, that is a severe breakdown of the muscles. And this is not good at all, because if this happens, it leads to release of a protein called myoglobin, and this is excreted by the kidney. So when it's excreted by the kidney, it can block those nephrons of the kidney and lead to acute kidney injury or acute kidney failure. So because of that, when a patient is on this medication, you want to watch out for those side effects and also tell them. One way to watch out for the side effect of rhabdomyolysis is ask the patient to check their urine very well. If it is dark or brown color, it could be suggestive of that breakdown of the muscles, which is rhabdomyolysis. Another one is hepatotoxicity. In fact, most of these cholesterol lowering medication have the side effect of hepatotoxicity. So you need to watch out for that. And then GI upset can also be there. Now, nursing role / nursing teaching. As a nurse, what are your roles? What are you supposed to teach the patient, and what are you supposed to watch out for when the patient is on this statins group of medication? So you should know that this medication, since it affects the liver, it can affect the liver, which is hepatotoxicity. You need to monitor the liver function test. Another blood work you need to monitor is creatinine kinase. Remember that the patient is at risk of rhabdomyolysis, and so you want to ensure that the kidneys are performing well. There is no blockage. So you need to monitor the level of creatinine kinase. Another thing you need to teach the patient is to take the medication in the evening. Very important. The reason is because cholesterol synthesis happens more at night. So it's better they take the medication in the evening when it's close to when cholesterol synthesis is supposed to occur. Then you need to teach the patient to report muscle aches. That is a sign of rhabdomyolysis or myopathy. And then teach the patient, generally any patient that is on cholesterol lowering medication, because of that risk of hepatotoxicity, they should not take alcohol. And then for this particular group of medication, the statins, you need to also teach the patient not to take grapefruit juice. The second group of medication you need to know is the bile acid sequestrant, also called the resins. So this medication, an example include cholestyramine. Now, the mode of action of this resin, just from the name bile acid sequestrant, is to bind to bile acid in the intestine, in the gut. So when it binds to this bile acid, the hepatocyte, the liver cell, will no longer see the bile acid to break down, and then they switch to breaking down cholesterol, and that will result to decreased cholesterol level and decrease low density lipoproteins. Therefore, the mode of action, since you know that lower cholesterol and lower LDLs, you know that it's for high cholesterol, that's hypercholesterolemia, and it's also used for high low density lipoprotein levels. Then the side effect you need to teach, very important. Number one is constipation. You need to teach patients about side effect of constipation because this medication is very chalky or very powdery. So when a patient is on this medication, your teaching will be centered around preventing or reducing constipation. Another side effect of this resins group of medication is that it can interact with a lot of medication. It can decrease the absorption of some medication. A popular one is warfarin. It can also interact with thiazide. It can interact with digoxin. It can also interact with Centrum, even fast soluble vitamins, vitamin A, D, E, and K. So you need to know about that. And then your teaching, like I said, because the side effect, the major side effect is constipation. So you'll be teaching the patient to take high fluids, up to 120 ml or even more when they are taking the medication. They should never take the medication in the powdery form. They should make sure they take a lot of water, dissolve it in a lot of water, and also teach them to eat lots of fibers to reduce that constipation. The third group of medication we'll be reviewing is the cholesterol absorption inhibitor, popularly called ezetimibe. So this medication, the mode of action from the name is to inhibit cholesterol absorption in the small intestine. So it ensures that cholesterol is not absorbed in the small intestine. Now for side effect, this medication kind of have the best side effect so far from these different classes of medication because it has the side effect is just the usual one of nausea, vomiting, diarrhea. There is less risk of hepatotoxicity and those muscle aches. Now your nursing teaching, you just basically just teach the patient to take this medication the same time every day. And it's also important you know as a nurse that this is the group of medication that can be combined with statins group of medication. The reason is because this group of medication, they work better when they combine them with statins. And because they have less risk of that muscle aches, therefore they can combine them with statin group of medication, of which we know that one of the side effects of starting group of medication is muscle aches and those rhabdomyolysis. Then the fourth group of medication we'll be looking at is the fibric acid derivative, what we call the fibrates. Examples include fenofibrate. Now this medication, the mode of action is to decrease high triglyceride. Don't forget, it decrease high triglyceride and it increase high density lipoprotein levels. Then therefore indication, since it's the mode of action is decreasing triglyceride and increasing high density lipoprotein levels, it means it's used basically for high triglyceride. So when the triglyceride is high, this patient will benefit from fibrates. The side effects of this medication, just like most of the side effects we'll be looking at, include hepatotoxicity, muscle aches, cholelithiasis, that's formation of gallstones. Now, your nursing role and your teaching also. So first, as a nurse, you should know that this medication can increase risk of myopathy when given with statins. So because of that, they don't place patients on these two medications, statins and fibrates. Also, you are going to be teaching the patient to report any abdominal pain, and that's because of risk of gallstones. So if patient reports any abdominal pain, it's pointing to gallstones. And then another thing you need to teach the patient is to take this medication 30 minutes before meal. That's to enhance absorption. Now, the last group of medication we'll be looking at is the nicotinic acid, that's the niacin or vitamin B3. This medication is used, especially when it's given in high amount, when it's prescribed in high amount, is used to lower low density lipoprotein. So it lowers that bad cholesterol level. Also, it also lowered high triglyceride and it increased HDS, the high density lipoprotein. That's the good cholesterol. So this medication is doing a lot of things. It lowers the LDL level, lower triglyceride, and increase HDL levels. So the side effects that you need to know include facial flushing. You need to know this, it can cause facial flushing, and that's due to increased vasodilation. To reduce that effect of facial flushing, it's been known that when patients take aspirin in applesauce, it helps to reduce that effect of facial flushing. And again, this medication can cause pruritus. It can also lead to increased uric acid. So you need to be careful when a patient that has gout is on this medication. So you use it cautiously in patients with gout. Also, there is risk for hepatotoxicity, just like with most of those medications. And the patient could also develop hyperglycemia. So in other words, you need to also give it cautiously in diabetic patients. Your nursing role or teaching, I've mentioned it already, so you need to use it cautiously in patients with gout and in patients with diabetes mellitus. Now let's look at some NCLEX-style questions on these antihyperlipidemic medications. Question 1. A patient taking atorvastatin reports new onset muscle pain. What is the nurse's best response? The answer will be instruct the patient to stop the medication and notify the provider immediately. Why? The patient is at risk of rhabdomyolysis. Question 2. Which instruction is most important when teaching a patient taking cholestyramine? The answer will be mix the powder with at least 120 ml of fluid and never take it dry. So we know that cholestyramine is a bile acid sequestrant. It's very chalky, it's very powdery, and it can lead to constipation. So the most important thing you'll be teaching them is to take that medication with a lot of water, a lot of fluids. Question 3. A client with hyperlipidemia is prescribed Niacin. Which common side effects should the nurse include in the client teaching? The answer will be facial flushing and pruritus. Now, question 4. A client is prescribed fenofibrate for high triglyceride. Which instruction should the nurse include in the discharge teaching? The answer will be take the medication 30 minutes before meal. The last question. A client is prescribed ezetimibe for hyperlipidemia. Which statement by the client indicates a need for further teaching? A. This medication works by decreasing cholesterol absorption in my intestine. B. I will continue to follow a low-fat, low-cholesterol diet while on this medication. C. I can stop taking my statin now that I am on ezetimibe. D. I will take this medication at the same time every day. The answer will be C. I can stop taking my statin now that I am on ezetimibe. Remember that ezetimibe is the only one that can be taken with statins group of medications. So when a patient makes this statement that they can stop taking their statin while they are on ezetimibe, you know that they need further teaching. So that wraps up today's topic on antihyperlipidemic medications. If you find this video helpful, please like this video, share, leave your comment, and subscribe for more educational videos. Thanks for watching.